That patient testimony serves as a powerful reminder of why we do what we do. We're now approaching one of the most important highlights of this afternoon, the inauguration of Adu Equatorial Hospital's Patient Safety Committee. This committee will play a pivotal role in advancing our commitment to excellence in patient care.
It is my honor to invite First Lady Madam Sajida Muhammad to inaugurate the Patient Safety Committee and award pins to our committee members. First Lady Madam Sajida Muhammad.
Dr. Ibrahim Yasir. Ms. Sophia Abdullah. Dr. Fatmat Amani Nasir. Ms. Nizna Hussain. Shah Said. Ms. Azlifa Abdul Aziz. Ms. Mariam Hawlat.
الله أكبر الله أكبر الله أكبر الله أكبر أشهد أن لا إله إلا الله أشهد أن لا إله إلا الله أشهد أن محمدًا رسول الله أشهد أن محمدًا رسول الله حي على الصلاة حي على الصلاة حي على الفلاح حي على الفلاح الله أكبر الله أكبر لا إله إلا الله
اللهم رب هذه الدعوة التامة والصلاة القائمة آت محمدا الوسيلة والفضيلة والدرجة الرفيعة وابعثه مقاما محمودا الذي وعدته وارزقنا شفاعته برحمتك يا أرحم الراحمين. وصلى الله على محمد وآله وصحبه وسلم والحمد لله رب العالمين.
So since then, we have been celebrating World Patient Safety Day in taking over different themes. So what is the agenda behind that? The agenda behind having a particular World Patient Safety Day per se is to advocate. If we didn't have this venue, Dr. Yasir would not get the opportunity to invite First Lady to come for the World Patient Safety Day. Simple as that. And not only that, it creates an opportunity to respond and share the findings. You advocate, identify the priorities, respond and share the findings. So therefore, that is the idea behind World Patient Safety Day, which falls on 17th of September of each year and celebrated lavishly and also very focusedly in Maldives. Okay, now I'll come to WHO journey in Maldives. We started our journey as early as 1951, 3 years after our inception. We first came here to support the country in a filaria mission. The partnership we built with the government of Maldives and Ministry of Health Maldives has grown from strength to strength, and we stand by as partners with Maldives Ministry of Health and other ministries related to health, and now with Addu Equatorial Hospital as well. This time I am really glad and I am happy that we were able to partner with Addu Equatorial Hospital in this wonderful patient safety conference. And I am also as glad to partner with Quality Commissioner in putting out the Mahara platform launched on the 17th of September. That is the pillar of people-centered healthcare. If you have a people-centered healthcare, you should give them the opportunity to give feedback and also have a grievance mechanism. So you have done that. All hats off to you and congratulations to you. And today, I will now focus on a few things I have observed on the health symposium, patient Symposium, Patient Safety Symposium at Agdu Equatorial Hospital. I have attended many a symposia, many countries, many forums, and this is second to none. So take it from someone who has a huge background in academia that this is second to none and it is of international level. So give yourselves a warm round of applause for that. What I observed here is that every minute detail had been thought of and accounted for in the planning. And in implementation, from keeping the time to taking part, it had been thoroughly planned and well executed by a professional team, not only of doctors. That is the nicety of that. It was a joint effort. Doctors took part, nurses took part, physiotherapists took part, and other stakeholders took part. While I was seated there and listening to you, that's what I had observed in highest professional caliber. So all hats off to you again, and please give a round of applause for that component as well. And I'm really happy to observe the culture of symposia, sharing of knowledge from the lowest or southernmost atoll that I have not seen in Mali this often. So it's something that we want to inculcate in the medical fraternity, so that innovations like this or innovatory practices are there, compiled, discussed, and disseminated. That's the main idea behind symposia like this. And it's the main idea behind having a World Patient Safety Day as well. So I would, as my last comment, I would want to congratulate each and every one of you who took part in the sessions, organizing it and taking part. And I want to wish all the very best to Agdu Equatorial Hospital. And I would expect lot of innovative, good things to come out of Maldives, as Maldives with WHO's partnership has been a front runner in the health mandate or health field in the region. We have had an achievement and a medal since 2015, every RC. We continue to do so. And I'm happy that we are expanding to the sub-levels, and Agdu Equatorial Hospital and other atolls, I would expect the same from the country. Thank you and all the best.
Thank you, Dr. Padmal. Your expertise is vital as we strive to enhance our patient safety in our hospital. Following that insightful address is another significant moment in today's event, the inauguration of the Patient Safety Strategic Plan.
This initiative is crucial as it sets a clear path to enhance the safety and care we provide. By focusing on proactive measures and continuous improvement, we aim to ensure that every patient receives the highest standard of care from our hospital.
I would like to kindly invite the First Lady of Maldives, Madam Sajida Muhammad, to inaugurate the Patient Safety Strategic Plan. Madam Sajida.
Thank you, Madam. This inauguration not only marks the start of a vital collaborative effort, but it is also a call for all of us, administrators, clinicians, and support staff, to unite with a shared vision for patient safety. Our success depends on the collective engagement and effective implementation of these strategies. As we move forward, let us remember that these are not just a set of protocols, but core values that should guide every aspect of our work.
The next item on our agenda is an address by Ms. Sophia Abdullah. the Nursing Director of AEH. Please join me in welcoming to the stage Nursing Director, Ms. Sophia.
Bismillahirrahmanirrahim. Distinguished Chief Guest, Madam Sajida Mohammed, CEO of Addo Equatorial Hospital, Dr. Ibrahim Yasir, Quality Commissioner of Maldives, Ustaza Taslima Usman, WHO Medical Officer Public Health, Dr. Padmal De Silva, our Medical Director, Dr. Fatmat Amani. Esteemed delegates and my dear colleagues, Assalamu alaikum wa rahmatullahi wa barakatuh, and a very good afternoon to you all. It is an honor to address you all today at this important patient safety conference. Today marks a pivotal moment in our journey towards safer healthcare. The essence of our work, healthcare professionals, revolves around one fundamental responsibility of protect lives entrusted to our care. Patient safety is not just a goal, it is a foundation upon which quality healthcare is built. As we gather to celebrate Patient Safety Conference, let us remember that every action, every decision, every process in healthcare must be centered to one principle, that is, do no harm. While the global statistics on patient safety may be sobering, today is about solutions, about collaboration, about collective commitment to change. The World Health Organization reports that 134 million adverse events occur annually in healthcare, resulting in 2.6 million deaths in low and middle income countries. In high income countries, 1 in 10 patients is harmed during their care. Medication errors alone costs over $42 billion annually. And diagnostic errors occur for 10% of patients' deaths. These figures highlight the urgent need for action at both global and national level. At AEH, we are acutely aware of these challenges and have identified medication administration errors and patient falls as two critical areas where improvements are needed. To date, collecting complete data on patient safety incidents has been challenging due to auditing limitation, but we are committed to addressing these shortcomings. These issues are not unique to our institution. They are global in scope, emphasizing the need for comprehensive strategy. Though preventable, these incidents remain persistent challenges in providing safer care. Addressing these issues require a systematic institution-wide approach. Our strategies to enhance patient safety at AEH focuses on several critical areas to enhance patient safety at AEH. We are committed to providing comprehensive education and ongoing training for our healthcare teams, ensuring they are well equipped, identifying risks, prevent harm, and manage common errors such as medication mismanagement and patient falls. Furthermore, enhancing our monitoring and reporting mechanism is essential for reducing adverse events through analysis and implement evidence-based interventions. Finally, fostering a culture of safety is paramount. We will encourage every staff member, regardless of their role, to actively engage in safeguarding our patients' well-being, creating an environment rooted in open communication, accountability, and continuous learning from incidents and near misses. This conference symbolizes our renewed commitment to creating a safer healthcare environment. It is thought the combined efforts of every individual in this room that we will build a future where patient safety is embedded in every aspect of our healthcare system. Let us commit ourselves to this vital mission, ensuring that we adopt comprehensive strategies, foster a culture of safety within our healthcare system. Together, we can make a meaningful impact and create an environment where every patient receives the safe, high-quality care they deserve. Together, we can transform this vision into reality, and also together we can get it right and make it safe. Thank you for your dedication and partnership as we embark on this vital mission. Thank you.
Thank you, Ms. Sophia, for your compelling speech. We deeply appreciate your ongoing commitment to this vital aspect of our mission.
Next on the agenda is a speech by our keynote speaker, Dr. Muhammad Wahid, on the topic of preventing surgical site infections. Dr. Wahid is a plastic and reconstructive surgeon and head of surgery at IGMH. He holds an MD from Santa Clara Medical School and specializes in plastic surgery at Sri Raj Hospital, Bangkok. Please join me in giving a warm welcome to Dr. Muhammad Wahid.
Bismillah ar-Rahman ar-Rahim. The First Lady, Madam Sajida Muhammad, CEO of AEH, Dr. Ibrahim Yasir, distinguished guests and participants, Assalamu alaikum and very good afternoon. First of all, I would like to thank AEH for inviting me for this successful conference. I would like to congratulate all team members of AEH for having this very important and very successful conference. Thank you very much. It is an honor for me to be here to speak on a topic of utmost importance in surgical department, which is not only for surgical department, but for whole health sector. It is to prevent surgical site infection and how it directly impacts on patient safety. As we know that surgical procedures, whether elective or whether emergency, that is always associated with certain risks. Among these risks, most preventable risk is surgical site infection. Surgical site infections are infections that occur at or near the surgical incision within 30 days, or if there is an implant, it may go beyond that. So this infection can cause significant threat to patients' recovery and safety. It can prolong hospital stay, increase medical costs, and in some severe cases can lead to life-threatening complications. However, the good news is that surgical site infections are largely preventable. Implementing rigorous infection prevention measures can significantly reduce incidence of surgical site infections. I would like to highlight three main areas that we can do enormous work in reducing surgical site infection. First of all, the proper preoperative care, which can include screening of the patients, educating the patient for surgery, And also, hospital must ensure that operation rooms are thoroughly disinfected, sterilized to create sterile environment for the procedure. Secondly, intraoperative protocols, such as once the patient is in the operating room, a sterile field must be meticulously maintained. And surgeons and entire team should adhere to the best practice in surgical technique to minimize the tissue trauma and prevent contamination during the procedure. Thirdly, post-operative care. Infection prevention does not end once surgery is over. Post-operative care plays a critical role in ensuring successful recovery. Monitoring the surgical site for early signs of infection, education of the patients, and follow-up appointments are essential. At the core of effective infection control is commitment of healthcare professionals, doctors, nurses, and all staff involved in patient care must be vigilant, adhering to evidence-based practice and infection prevention guidelines. Equally, it is important the role of leadership in fostering a culture of safety in healthcare settings. Hospital administrators and policymakers must ensure that resources are available for staff training, up-to-date equipment, and robust infection control system. So to conclude this, preventing surgical site, it's about saving lives. Preventing surgical site infection is about saving lives, reducing suffering, and ensuring that every patient receives safest possible care. By focusing preoperative, intraoperative, and postoperative measures, we can drastically reduce surgical site infection. So let's work together to ensure that every surgery we deliver have the safest and healthiest outcome for our patients. Thank you.
Thank you, Dr. Wahid. Your expertise is greatly appreciated.
Up next is the official inauguration of the Advanced Wound Care Management Service, a momentous occasion for our hospital and our patients. This service represents a transformative advancement in patient care, offering innovative solutions that will redefine wound management and significantly improve lives. It is my great honor to invite the CEO of AEH, Dr. Ibrahim Yasser, on stage to officially launch this service. Dr. Ibrahim Yasser.
Thank you, Dr. Yasser. May I now kindly request you to address the gathering?
Bismillahirrahmanirrahim. Respected Chief Guest, First Lady Madam Sajida, Deputy Mayor of Ado City, WHO Medical Officer Dr. Padmal, Commissioner of Quality Assurance, Al-Ustad Taslima, our guest speaker, Dr. Wahid, my dear colleagues, invited guests, and ladies and gentlemen. Good afternoon and Assalamu alaikum. Today, before I start my speech, I just want to tell you a story. This is a real story. A patient who is a regular hospital visitor, he comes for routine dressings, comes in one morning only to face a tragic accident. A simple slip on the ramp on the OPD ends up shattering his hip. It's a heartbreaking story, and one could that have been avoided. This incident was the catalyst for the significant change in Addo Equatorial Hospital. That is the reason the Patient Safety Committee was formed. When I received the patient complaint that morning, I immediately sought to address the issue. I directed my PA to forward it to the Patient Safety Committee for investigation. However, to my surprise, we did not have a formal committee in place. Fortunately, I have to say that our hospital has a very good quality improvement and patient safety unit, which was established in the nursing department. They were diligently investigating incidents and providing recommendations. Recognizing the need for a more comprehensive approach, I decided to establish a dedicated including administrative heads, to discuss these incidents and identify root causes and implement necessary changes. That is the reason the Patient Safety Committee was formed, and which was inaugurated today early in this session. And yes, Taslima was asking me, we are going to include a patient representative in the committee as well. Since its inception, our committee has met monthly to review cases and develop strategies to improvement. One of the most significant outcomes has been the implementation of measures to prevent similar accidents from happening in the future. Remember the patient who fell. He required hip replacement surgery. A simple visit to the hospital for a wound care landed up with a major operation. And do you want to know what the Patient Safety Committee has done? The ramp now has a hand railing. The ramp now has a anti-slippery stickers on it. So it's an important step that has been taken. Thanks to the changes implemented by our committee, we have been able to reduce the risk of such incidents in the future. A simple change in the system can prevent a lot of pain and suffering to our patients. Our story is not unique. The patient safety movement, which started way back in 1999 by the Institute of Medicine report, To Err is Human, highlighted the alarming number of preventable medical errors that happens all over the healthcare institutions. This has spurred healthcare organizations around the globe to prioritize patient safety. The key factors that have contributed to the progress in patient safety include creating an environment. Today, in the morning also, we are talking about it, creating an environment where health professionals feel comfortable reporting errors without fear of punishment. Also, we have discussed the advance in technology has created an environment where electronic health records have helped to reduce the risk of errors. You will understand the way in which we used to write prescriptions before. There are so many errors that happens when we have eligible prescriptions. So electronic medical records has bring wonders to reducing the risk in healthcare settings. And in the future, as we have discussed, using more of artificial intelligence to reduce the risk of errors can improve the patient outcomes. And also, again, we have discussed about the communication gap, working together as teams to address the issue of patient safety. While we have made significant strides, patient safety still remains a complex challenge. Stories of medication errors, stories of hospital or healthcare acquired infections, and stories of patients falling from bed are stories that we hear daily in a hospital setting. I'm sure someone from the audience will remember a patient who received a wrong medication, or a patient who has undergone surgery and later had some infection, or a patient who has fallen from a bed. These are real-life examples of the risk that patients face inside our healthcare institutions. But there is hope. By focusing on key areas, as Dr. Padmal has indicated, we can make a real difference. Preventing medical errors, implementing measures like barcoding, e-prescribing can help ensure that right medication gets to the right patient at the right time in the right dose. Combating surgical infection, Dr. Wahid has already told about it. I don't have to tell anything more about it. Improving communication is very important. Enhancing communication and teamwork among healthcare workers can prevent misunderstanding and errors. And about the patient empowerment, encouraging patients and their families to be active participants in their care, especially in the early diagnosis part. If they give correct information, if we are able to talk to them, get the information from them, we'll be able to arrive at a diagnosis, at a correct diagnosis at an early stage. For all those here who work in the hospital care setting, I just want to urge you to take patient safety one of your priorities. Before concluding, I just want to express my sincere gratitude to the First Lady for honoring us with this occasion in Addo City. And her commitment to patient safety is truly inspiring. Thank you, Madam Sajida. I'm also related you, Dr. Padmal, to Addo City. It's the first time he has come to this area. And his expertise in the panel discussion was a valuable asset to this patient safety event. And I'm honored that he accepted my invitation and contributed. Thank you very much. And our Quality Assurance Commissioner of Quality Assurance, Taslima, I would like to express my gratitude to Taslima for her excellent participation and for accepting our invitation. Thank you. And to you, Dr. Wahid, you came here not only as a guest speaker to this conference, he has already finished a 2-day pre-conference workshop. So thank you. I just want to tell that I personally would like to thank you for your contribution. I also extend my heartfelt thanks to the dedicated team behind this event, especially the Director of Nursing, Sophia, and his patient safety team, led by Nizna. Their hard work and dedication were instrumental in making this event a success. Finally, I would like to acknowledge the contributions of all the heads and their department staff who got involved in this, all the preparations that were gone behind the scene. Your support and participation have been invaluable. Thank you all. To all our participants who came from different regions of the country, thank you for traveling to the Southern Hemisphere for this important event. I hope you will benefit from the sessions you had in the morning. Please enjoy the warm hospitality of Addo City, and as I have already invited you, you are welcome to Addo Equatorial Hospital. Thank you, and wassalamu alaikum.
Thank you, Dr. Yasser. Now I would like to request you to present a token of appreciation to a truly distinguished guest.
As we all know, our First Lady has been a steadfast advocate for safety in healthcare, demonstrating unwavering dedication and passion. We are incredibly grateful for her tireless efforts to uplift our community and to serve as a beacon of hope and inspiration. It is my honor to invite the First Lady, Madam Sajda, to the stage to accept this token of appreciation and address all in attendance. Please join me in extending a warm welcome to the First Lady.
Thank you. Thank you for the token of appreciation. That was quite overwhelming. First of all, I would like to, the whole conference has been arranged in English, but then since I'm going to take the advice from our Quality Commissioner about effective communication, I'm going to deliver my speech in Divehi language in the interest of our public. Bismillahirrahmanirrahim. Dulahiyo kamaki insana mativeri niyomate kamgallevi ogavanta mang Allah hamdu kuran. Hayatuge komme kamige emme rakkateri magu dekkevi lobveti nabiyya yashai emen nabiyyage ashabunna salawatu salam lavwash. Addu Equatorial Hospital ge Chief Executive Officer Dr. Ibrahim Yasir wadagen tibbe izzetterin emme ha hazirin assalamu alaikum wa rahmatullahi wa barakatuh. Ade miyadu algon men faha kuram midani duniyage balimihunge rakkaterikamuge duwas mi balimihunge salamata rakkaterikamuge muhimmukan emmenan anga dinumasha mikamman helun terikuruma faha kureve duwahe mikan algon menge miyadu mihingadia symposium adi miyadu mitanuga mi dekevun huriha wahakatakum wes wara bodan almennan aduivige hingacce mi rajyege mifenwaruga duniyage balimihunge rakkaterikamuge duwas malen beruga faha kureve furatama fahar balimihage rakkaterikama masekke kurumaki muli sihi nizam ga himene emmenge shamilum beenum wakame migotun mi hospitalun isnenge wifada rajyege eki kankoluta hoga kulagaduko miduwas fahaga kurumuge iturun aharuge komme duwehek gaves adi komme wagutek gaves masikke kuramwani balimihage rakkaterikama iskandige balimihage rakkaterikamaki waki kamege gotuga nubala ei kura masakkataka lamehi fawa kamege gotuga dekigen sihi khidmatige rakkaterikamaki divehinge iturun rajya gawle bidesi na rajya ziyare kura fatruweri na wes libidenche haggekam fahag kura midohoge tahuniya sihi khidmateri nasha sihi nizam hingumuge masike kura faretakasha emmeha divehi rayatunna dannawa adi sihi nizamarki rayatunna rakkateri khidmatekkan kashwar kuruma sarkarun kurawwa masakkatattaka rajyege izzete raisul jumhuriya asha sihata behe wazira midohoge tahuniya ariskura adi duniyaga balimihunga salamata rakkaterikama khasa duhe faha kuren feshoni dehas nawarwana har mi wahaka almenna WHO ge Dr. Padmal ge faratum wes aduyuge hingacce ehnames algon hama divehi bahun anekkais takuraru kollani mi wahakata eduhaki komme aharige wes September 17 wana duwas rajyika midwas miyahar mi faha kureni miyaharuge shiara adi maksata hasil kurumuge ummeeduga miyaharuge shiar almenna wara ginafaharu ivige hingacce mitanuge improving diagnosis for patient safety ade balimihage rakkaterikamataka bali denegatumuge gottan harudanako femwaru matikoru migotun kama behe mashwarataka bahustakattaka khasa komitiya miyadu mitanuga ufedige hingacce adi mi addu Equatorial Hospital ge faratu diagnostic safety aigule wara furihamadi ehame muhimu fanni conference miyadu wani kuriya gendawaf algodhama adives effaharu mitanugama ehem befulum wes faha kurevi gota miyadu mi gendia conference algonda miyadu mitanan aske mi fenunu manzara bala hama tiya befuluna hagigatuke shukuru haggove em algond ge namuga hama tiya huriha befuna wakin hasako Dr. Yasir ge malimi kamuge dashuga tiya team miyatti kurevamuge da masekata asari bahai sabas tannawa mige ituru sihi khiduma for ko dinumuga balimihage rakkaterikama khas samalkame dinuma beenumwa usul takai procedure ta adi muli sihi nizam hardana kurumai muwazzafun tamrin kuruma ahulweri kurumuge masekke kuriya gendimaki algondge edume mi masekke kuriya gendiuma wasiletta tanawas kurewumaki balimihunalli bena wara bodu hinhama chehume dulahe komattaka hulwena waran itubaru huri mage hame hemme mikamuga addu Equatorial Hospital isve mifada badaltake kennam feshumaki yes mifursattuga algondu wara faha kolla kame mikamuga sabum muli misarhadduge rattahoga diriule rayitunna a ummid taka itubar ade khidmat takai rakkaterikan libigen danikan yagin kura bali mihunge rakkaterika mattaka ala taaraf kurawunu strategic plan tanfiz kuruma bali mihage bali avaha denegatuma beenumwa intizam tar revuma beenumwa besfarwage kankan avas kuruma dairage mozzufunge malumat fumwe hunaru mativegen diumaki hagigat gas bali mihage rakkaterika ituru wegen daane kame adi strategic plan tanfiz kuramun diumaki libe warabbodu kuriyerume heyo badale balimihunge farkaterika mattaka bainal aqwami femwaruga duwahe faha kuren feshi ekamge waran hitama veri hagigeteke ekulegen wati miyad algon menna mitanu effada etan hagigaten adu ivigen hingacce samalkan devijjenama farwateri vevijjenama rangal kurevene etakamen huriti ekan duniyage sihhat jamiyage dirasa takun enge duniyage sihhat jamiyan ham kuragotuga balimihunge gotuga farwa deve komme dihamege hege teren ekaki farwa dinumge terega hede gohu gellun libe mihe migotun deve farwag sababu nuwat farwa deve gotuge sababu libe gellumge terega aharaku duniyen 3 million mihun duniya du kure algon men kahala targi wamun anna gaum taka dan adi medufantige gaum toga mifal masalata ma bodukama ve ama ehemme algon menna miyadu mitanun adu evigen dia algon menna diagnose nukura vitibe mita fasi sabge terega nuhimeneka ehem bumu mihar algon menna mi fenna waravuren ves itura mi number macca danekan hamayagi egotun dirasa indakka gotuga fagiru gaum taka medufantige gaum toga komme sateka mihakun hatara mihun faruha dinumuge terega hede gohuge sababu maruwe hama ehemme nurangal ko deve farwag sabun gellumwa mihunge terega farwa dinumge marhalage terega rakkaterikan kashawaru kurumun farwag sabun libe gellun kuda kureve nuwata avoidable harm in salame kurevigende balimiha deve behuge sabun nuwata bes deve gotun sihi gellun ta libe munde farwa deve gotte midennevi tafat etan halati ves himene gotu doctor nudeki hedawa muddatu doctor dakkan hospital agendiu mangadi hospital agendiu mafahu laswa lasvu dur tantanum farwaya hamaya awmuga itura libe gellun hama ehemme bay fahara operation ta kurumuga ekashene samalu kanu devun saftahiru kamar rakkateri nuevun ege sabun infect vun mige itura balli denegatumga ara olunta adi balli miha medu ves bay faharu olun ara munde ekaka denje he base anikaka deve halat wes duniyage bayin hospital tahuga tajriba kure fa bahuri hama ehemme le olumuga dimawa kankan rakkateri lekan kashawaru kurun mifada etak kame mi huriya kamaka balairo min komme kamari kiye komme wes gotega divehinge tajriba wes guri fa kankan ei rajyege zamani sihi farwa fishumuga kurim wes adi ege fahum wes bayin halittahuga miharis mifada etat kame kurimative misalaka rajyaki kanduveri gaume divehin diriuleni maakandikka durduruga atirfawa waki rashuga ehem vima kulliyaka dimawa sihi halatiga wage magum vies adi kanduge magum vies miharu bali miha eba ufule geneve namavis ekamang hedawa wagutu visnala mato adi bayin halatuga ekan kuram majburuwa gotamedu visnala mato rajyege kuda kuda rashiga hunna mihaka misalaka stroke jehun fada kame medurwa halatuga jehigen oy rashge hospital agendan jeheni kandu magu gada duwasware nama bodu tiralta hoge matiga e halatuga ituru gellunta medurum ki vedane kame rajyege tarikha belima es mikanka mara fahaga kureve mege salihakkan ahar kuri vihomge terega niyavi etan anhenune duniya dukuri eta kudaku dinne algon menna wakive diei farwag marhalaga ekashene gotuga kankan kurefawa netumuge sabun kama eduas varse hidairaga masekke kuri eki befulum vidalwe ehem vima dive komme rayetege salamat sihhat kashwar kurumattaka duniyage balmiyunge rakkaterikamge duas fahaga ko mikankam mihunge samalkama genas sihi kankan itura hardana kuram mase kurmaki komme hem ves kuram vecche kamekama alugandu dekken algonge wahaka ma dev kuraka gastenno kuram ehennama ves adi detin etche dannawalana duniyage sihat jamiyage miduas faha kurmakama be hodun tawge matcha plane ta ekulawa labwa fave එයායකු මසල්ත හල්ලු කුරන් අමල් කුරම් වී ගොත්තකේ හාසිල් කුරම් වී ලඬු දඬිතකේ ෆාහක කුරවා ෆෑවේ අදි එකංකං හාසිල් කුරවේනි කිහිනේ කොංකහල මසක්කතෙක්කොන් ගොතකක් කොග්ගෙන් කම්වෙස් ෆාහක කුරවා නතිජා හාසිල් කුරවේනේ ගොතම් මසෙක්කෙත් බට්ටන් කුරවා ෆෑවේ එහෙන් වීමා දුනියාගේ සිහත් ජමියාගේ ස්ට්‍රැටජික් ඇක්ෂන් ප්ලෑන් ආයි එගොත අදි අල්ගොන් මෙන්ගේ රාජ්‍යයේ වෙට්ටා හාලත ෆෙතේ ගොත අල්ගොන් මෙන්වෙස් මසක්කෙතකේ කුරන් ජෙහෙකම අලුගණ්ඩ ෆෙනේ එම්මෙ ෆුරතකම රාජ්‍යයේ හාලත දෙනෙගතු දිවෙහින්ගේ කුරිමති හුරි මස්සලත දිවෙහින් තජරිබාතක ඒගේ සබබතන් හෝදු දිවෙහින්න දතිවා මස්සලත දෙනෙගතු එයෆහු එකංකං හල්ලු කුරු මට්ටක දිවෙහින්න දිවෙහි රාජ්‍යයා ගුලේ ගොත උසූල් තකෙන් එක ෂයලු විහාවිස් කින බයිගේ මෂ්වරායයි ලෆා හෝදු ෆර්වා ලිබිගන්න ෆරාත්තකුන් හෝදේ මවලූමාතයි ෆර්වා දේ ෆරාත්තකුන් හෝදේ මවලූමාත විස් ඉස්කන් දෙව්වු මී මුස්සසාතකයි සියාසත් කණ්ඩායුවා ෆරාත්තක අදි එනුම් වෙස් තායිරාත හිමිනේ ශාමිල් මසික්කතෙක්කම් ගා හෙද්දෙවු ඒරු වරන් එදවේ නතිජතකේ හෝදි දානකම අලුගණ්ඩ ලෆා කුරෙවේ ආදේ ನಿಮ್ಮಾಲಮ ಅಳ್ಗೊಂಡು ಮುಹಿಮ್ಮು ದೆತಿಂಕಮ್ಮೆ ಫಾಹ ಕೊಲ್ಲಾಣ ಫುರತಮಕಮಕ ಬಲಿಮಿಹಾ ಫರ್ವಾ ದೇವೆ ಗೊತ್ತುಣ್ಣ ದೇವೆ ಫರ್ವಾಗೆ ಬಾವತು ಫುರಾಣಯ ಶಾಯ್ ಹಶಿಗಂಡ ಬೊಡೆತಿ ಗೆಲ್ಲುಂತ ವಿಫಾವುಮಕಿ ರಾಜ್ಯಕ್ಕೆ ತಾರೀಹು ಗ್ಯಾಸ್ ಅದಿ ಮಿಹಾರೆಸ್ ಬೈ ಫಹರ ತಜ್ರಿಬಾ ಕುರೆವೆ ಕಾಮೆ ಎಹೆಂಕಮ ಖಿದ್ಮತಿ ನುಮ್ಗ ಫರ್ವಾ ತೆರಿವೆ ಮಿಕಂಕ ಮದುಕುರುಮ ನುವತ ನತ್ತಾಲುಮ ಮಸಿಕ್ಕೆ ಕುರು ದೇವಣ ಕಮ್ಮೆಗೆ ಗೊತ್ತುಗ ಫಾಹ ಕೊಲ್ಲಂ ಬೇಣು ವಣಿ ಮಿ ಹಗೀಗೆ ಗಬೂಲ್ಕೊ ಅಳ್ಗೊಂಡು ಮಿಂಗ್ ಗೌಮಿ ಹುರಿಹಾ ಲೆವಲ್ಲಿಗ್ಗ ಮಿಕಂಗ ಮಶ್ವರಾಕೊ ಆರುಲಾ ನಿಮ್ಮುಂತಕ ನಿಮ್ಮೆ ತಂಫೀಸ್ಕೊ ಸಿಹಿ ದಾಯಿರಾಯ ಇಂಗಿಲಾಬಿ ಬದಲೆಗ್ಗೆ ನಾವು ಮಮ್ಮ ಸಿಕ್ಕೆ ಕುರು ಅದಿ ಫಹುಕಮ್ಮೆಗೆ ಗೊತ್ತುಗ ಬಲಿಮಿ ಹುಂಗ ಸಲಾಮತಟ್ಟಕ ಆ ಉಸೂಲ್ ತಕಾಯ್ ಆ ವಸೀಲತ್ತ ತಾರಫ್ ಕುರೆವಿ ಫುರಿಹಮ್ಮೆಂಗೆ ಕಂಕನ್ ತಂಫೀಸ್ ಕುರೆವೆ ಫಶಾದು ಹಕಿ ದಿವೆಹಿ ಸಿಹಿ ದಾಯಿರಾ ಉಸ್ಮಿನ್ ತಕ ದತುರು ಕುರು එහෙන්කමු ಖಿದಮತುಗೆ ಫೆಂವರ್ ರಂಗಳು ಕುರ್ಮುಗ ಬಲಿಮೀಹಾಗೆ ರಕ್ಕಾತರಿಕ ನುವತ್ತ ಫರ್ವಾಗೆ ಸಬ್ಬುಮ್ ಗೆಲ್ಲುಮೆ ವಿಯನು ದಿನುಮ್ಗೆ ಮತಿವೆರಿ ಮಕ್ಸದ್ ಅಬದುಮೆ ಇಸ್ಕುರ್ಮ ಅಳುಗಂಡು ತಿಯ ಎಮ್ಮೆಹಾ ಸಿಹಿ ಖಿದಮತರಿನ್ನ ಇಲ್ತಿಮಾಸ್ ಕುರ ಅಳುಗಂಡ್ಗೆ ದುಆಯಕಿ ದಿವೆಹಿ ರಾಜ್ಯಕಿ ಸಿಹಿ ಗೊತು ಇತು ಬಾರು ಹುರಿ ರಂಗಳು ಫರ್ವಾ ದೇವೆ ಮುಂದ ರಾಜ್ಯಕಮ್ಗ ತರಗೀವೆಗೆಂ ಅವು ದಿವೆಹಿನ್ನಕಿ ದುಳಹೆಯೊಕಮಾಯಿ ಹಶಿಹೆಯೊಕಂದಿಬಿಗೆಂವಾ ಗೌಮೆಕ್ಕಮ್ಗ ಲೆವ್ವು abadu eskurieru mai ufavirika minwar kurevu ma Allah algon me mikankam ge hew tawfiq de bash assalamu alaikum wa rahmatullahi wa barakatuh.
We extend our deepest gratitude to Madam Sajida for your inspiring address. We are truly grateful for your support and the impacts your word have on our mission.
We have finally reached the end of our ceremony. To present the closing remarks, I would like to invite Ms. Nizna Hussain, Chief of Patient Safety of QID at AAH. Ms. Nizna.
Distinguished Chief Guest, First Lady of the Maldives, Madam Sajida, CEO of AAH, Dr. Ibrahim Yasir, Quality Commissioner of Maldives, Ustaza Taslim Osman, WHO Country Officer for Maldives, Dr. Padmaldi Silva, Director of Nursing, Sophia Abdullah, Medical Director, Dr. Amani Nasir, and all invited delegates across the country. Good afternoon. As we gather here at the close of this remarkable National Patient Safety Day conference, I want to take a moment to reflect on why today and every day dedicated to patient safety holds such profound significance. Today was more than just a series of sessions and discussions. It was a powerful reaffirmation of our collective commitment to those we serve. Patient Safety Day serves as a reminder that we are not just caregivers, but guardians of lives, advocates for our patients, and champions of healthcare systems that prioritize safety above all else. Patient safety is not confined to a calendar date or limited to one day of celebration. It is a continuous commitment and enduring promise to every individual who walks through our doors, placing their trust in us during some of the most vulnerable moments. Each story shared, each statistic discussed today reinforce that we are part of something larger and intricate web of care where every action occurs. As we stand here, reflecting on the discussion of the day, we must remember that our work is just a beginning. The initiatives we have launched are not mere aspiration. They are stepping stones towards a culture of safety that we must diligently cultivate. We have set ambitious goals for ourselves, and it is our responsibility to ensure that these goals translate into a meaningful change. Since the launch of our quality improvement and patient safety project in 2022, we have seen significant success. We have seen tangible improvements in patient outcomes, reduced error rates, and stronger culture of safety among our staff. These milestones are not just numbers. They represent lives improved, family comfort, and a commitment to excellence in care. Yet, as we celebrate this achievement, we must also acknowledge the challenges that lie ahead. Our journey is still in the early stage, and there is much work to be done. One of the most essential needs during this early stage of our patient safety initiatives is targeted training. Our staff must be equipped with the skills necessary to utilize data effectively and to engage in continuous learning. Imagine a future where our commitment to patient safety is so deeply embedded in our practice that it becomes a second nature. A future where our teams are equipped with the skills and knowledges to prevent error before they occur, where each patient feels secure and cared for, and where our collective efforts lead to better diagnosis and improving outcomes. To achieve this vision, we must move beyond conversation. We must practically implement the initiatives we have developed, investing in targeted training and innovative solutions that empower our staff. This is where our vision for a simulation lab for hands-on training comes into play. The establishment of a simulation lab is not just a beneficial addition, it is a vital necessity for us, the main tertiary hospital in southern region of the Maldives. A simulation lab will provide our health professionals with a safe space to practice and refine their skills in realistic scenarios. The hands-on experience is invaluable. It bridges the gap between theory and practice, enabling our staff to respond confidently and competently in real-life situations. Moreover, a simulation lab will foster a culture of collaboration and teamwork. By training together, our multidisciplinary team will learn to communicate more effectively, enhance their problem-solving skills, and develop a deeper understanding of each other's role in patient care. This collaborative environment will ultimately translate into a safer and more cohesive care for our patients. In light of this aspiration, I would like to extend my heartfelt gratitude to those who have made today possible. First and foremost, I would like to thank the First Lady of Maldives, Madam Sajida, for honoring us with her presence at this special occasion held in ensure safety for patients. Your presence and support highlighted the importance of our mission and inspired us all. Thank you, Madam. We sincerely appreciate your advocacy to enhance healthcare in our community. Ustaza Taslima Usman, Quality Commissioner of Maldives, thank you for your relentless dedication into patient safety and quality improvement in the Maldives. Your tireless efforts and exceptional leadership have not only transformed healthcare standards, but have also inspired us deeply. Your close guidance and support have been a beacon of hope as we navigate our own journey toward excellence. Lastly, to our CEO, Dr. Yasir, and all the staff from each and every department of AEH, thank you for the hours of hard work and put into making this event a success. Your passion for the patient safety shines through every day. As we continue to strive for excellence, let us remain united in our mission. Patient safety is a shared responsibility that transcends department, specialties, and hierarchies. It is our duty to work hand in hand, continually improving our process and ensuring that safety is not just a goal, but an integral part of our culture. In closing, I urge each of you to take the inspiration from today back to your teams, your departments, and your communities. Let us not allow the momentum we have built today to fade. Instead, let us carry it forward, fostering a culture of safety and excellence that will echo for generations to come. A special thank you to our partners at the World of Health Organization, especially Dr. Padmal. Your collaboration and insight were invaluable, and we appreciate your support in our efforts to improve healthcare. Thank you, sir. Mayor of Addu City and the council members, thank you for your invaluable support and dedication to our community. We are so deeply grateful to the STO for their sponsorship, enabling us to bring this conference to life. Dear Dr. Mohammed Wahid, thank you for your pivotal role in establishing advanced wound care management at AEH. Your direct mentorship for our team has been essential in enabling us to successfully implement this important service. Thank you, sir. A sincere thank you to the National College of Law Enforcement for allowing us to use this facility. And thank you to each and every organization that has contributed to mark this National Patient Safety Conference a success. Your support and collaboration have been invaluable. Together, we can and we will create a safer, more compassionate healthcare environment for every patient who walks through our doors. Thank you for your dedication, your passion, and your continuous dedication to patient safety. Let's continue this important work together every day to improve diagnosis for patient safety. Let's get it right and make it safe. Thank you.
Thank you, Ms. Nizna. Ladies and gentlemen, as we conclude the National Patient Safety Conference, let us reflect on the profound responsibility we share in safeguarding the well-being of every patient who walks through our doors. Today, we have explored the critical importance of improving diagnosis and reducing errors, not just as a goal, but as a moral imperative.
Each one of us here has the power to make a difference. By fostering a culture of transparency, collaboration, and continuous learning, we can ensure that our patients receive the highest standards of care. Let this commitment to excellence go beyond today. Let it inspire us to act decisively and compassionately, remembering that behind every statistics is a life, a family, and a story.
Together, let's carry forward the dedication and passion we've shared today, ensuring that patient safety remains at the core of everything we do. Together, we can turn our shared vision into reality. Thank you all once again, and have a wonderful day. I would like to invite you all to join us for refreshments in the lobby area.
Thank you. May I invite our newly inaugurated Patient Safety Committee on stage for a photo opportunity with our First Lady, and may I kindly request Madam Sajida to join the committee.
Hey, you! Konkalala jahala denvi. Kasarukada lavetta. Lobige lavetta. Nashala kala lavetta. Nuni ma kurige lavetta. Nenun lave request kolla. Komme home